Good afternoon, everyone. I'm Governor John Carney. I'm joined today by Dr. Carol Rattay, who's the Director of the Division of Public Health, Dr. Susan Bunting, who's our Secretary of Education. To both of you, thanks for your great work. Thanks for being with us today. And Pam, our sign language expert for the deaf and hard of hearing. We're delighted to have her again, as usual, for our weekly press conference, our update on Delaware's response to COVID-19. We have a lot of really good and important information to share today. We have some good news and some words of caution as we normally do. And we have Dr. Bunting with us to talk a little bit about vaccinations among teachers and school staff, which is going really well. We also are making progress getting Delaware students in front of teachers for in-person instruction, close to over 70,000 students between public and private schools, which has been one of our primary goals from the beginning. And Dr. Rattay is going to talk quite a bit about a really positive development, which is the emergency use authorization of the FDA for the Johnson & Johnson single-dose vaccine. We've been talking about that for a number of weeks. The authorization came out just over the last couple of days, and today we had delivery of 8,000 single-dose Johnson & Johnson vaccines to our states. I've been saying for a long time that this is a game changer because it enables us to vaccinate Delawareans in a way that's a lot easier than the two-dose Pfizer and Moderna vaccines, which require a second dose scheduling 21 and 28 days after receiving the first dose. We had a really strong clinic I'll talk about in a minute at Dover Downs this week, where we delivered over 10,000 second doses to Delawareans who received their first dose at DMV in Delaware City and Georgetown a month or so ago. If you think about it, just in simple math, you can, with 50,000 doses from Johnson & Johnson, you can deliver or fully vaccinate 50,000 Delawareans. It takes 100,000 vaccinations to fully vaccinate 50,000 Delawareans with the two-dose vaccines from Pfizer and Moderna. So it really is a game changer. We had quite a bit of conversation about it on the White House call this morning with all the governors very excited about this new development and talking about different ways they can use it. We will be using it for all populations in our state. The advice that we're giving is these are the very effective vaccines, all of them, and you should take the first vaccine that's available when you can and when it is available. I, for one, like the whole idea of a one-dose vaccine and would be pleased to lead the way if need be to show my fellow Delawareans that this is a good way to go. We did hear some concern on the White House call this morning from Dr. Lewinsky of the CDC about seeing a slight rise or flattening out of the reduction in positive cases and hospitalizations and fatalities across the country. And just a word of caution to each of us to be careful, to continue to follow mitigation strategies, wearing masks, keeping socially distanced, avoiding social gatherings where that's not occurring, and just being cautious. We did have seen over the last couple weeks an outbreak in cases among students at the University of Delaware. Basically similar situations, not following all the mitigation strategies and mask wearing and congregating. And it's just an example of the vigilance that we need to continue to have to make sure that we continue to improve conditions on the ground in our state. I did have a call with the mayors of the cities and towns across Delaware earlier this morning, and the reports from each of them was they see very good mask compliance in the towns, outside and inside. And again, social distancing, even though we have loosened up our restrictions a little bit and enabled bars and restaurants to go to 50% capacity and other indoor gatherings. But just a word of caution there. It's way more riskier indoors than it is outdoors. We're getting closer to spring. We're here at March the 2nd, and spring is around the corner, and we'll be able to move some of these venues outdoors pretty quickly. Our major focus, we continue to test at very high rates, and you'll see in a minute from the data that we're getting percent positive right around 5% and below, which has been our goal from the World Health Organization. We continue to focus huge efforts on vaccinations. We had a very successful clinic, and just have to thank our federal partners from FEMA, who came into our state with about 250 volunteers, federal employees from across the country as far away as Yellowstone National Park, those who work for the Park Service and their medical crew as far west as the state of Washington and everywhere in between that ran clinics there at Dover Downs, where we were able to fulfill second dose obligations for over 10,000 people that we vaccinated at the DMV sites in Delaware City and Georgetown a month or so ago, and also to do over 2,000 of Delaware's educators, teachers, education staff, and child care providers. And I talked to a number of those teachers and child care providers, and they were so excited to get vaccinated. I did meet with and talk to the teacher leadership group this week, and they are seeing a noticeable reduction in anxiety amongst teachers and staff as more people get vaccinated and as the community gets healthier. We do have, as I said, over 70,000 students in public and private schools back in classrooms, and that's been a major objective of ours. So we continue to push getting vaccines out in a fair and fast way. So we have the large clinics. We also have targeted community-based clinics with many partners, including churches and community service organizations. And folks, we're actually making phone calls out into these communities to try to register people. So pay attention to your phone, and when you get an opportunity to get an appointment to get a vaccine locally, we would encourage you to take advantage of it, whether it's a first dose, a one-dose J&J vaccine, or whether it's a two-dose Pfizer or Moderna. Both will be coming to a vaccination site near you. As I said, we have tested significantly teachers beyond the availability of the doses at Dover Downs. Total, we've got about 5,500 educators that have been vaccinated. Our school nurses have been outstanding. In case anybody missed that, I said our school nurses have been outstanding in helping run the DOE clinics in districts across our state, and they will continue. To everybody that's been involved in that, we thank you for your efforts. So some good news this week. Our data is improving. Conditions on the ground are improving in Delaware, and we've got the J&J one-dose vaccine that's arrived in our state. So let's go to the data dashboard, and we'll walk through our presentation today. You can see that, again, the number of new cases on a 7-day moving average are below 300. We still want to be much better than that. The percent positive of the test administered, again, under 5%, which is the goal. Hospitalizations just over 150. We ticked down below 150 earlier in the week. You'll remember that just a couple weeks ago, that number was 474 at the peak. And sadly, of course, we continue to have mostly our senior citizens succumb to COVID-19, and their lives are lost, and that's sad for all their family and friends, and something that we keep in mind as we do our work each day. But number of positive cases on a day-to-day basis is getting better, flattening out there a little bit. So you need to be cautious, need to continue to wear a mask. Percent positive is under 5%. Part of that is we're continue to do significant testing way beyond what our target was back in the spring, and hospitalizations moving down as well. So if you look at the testing we're doing, we've got, again, over 627,000 people who've been tested. So that's individual Delawareans, and many of them have been tested more than once. You can see 1.4 million tests administered, and that's really helps us to get a handle on the spread of the virus and whether it's improving in our state or not. As we look further down the next slide, you can see our focus on vaccination. Over 220,000 doses have been administered. That's the combined doses delivered to the state and to the federal pharmacy program. We do have a number of doses, over 50,000 there, that are already allocated, waiting to be moved out into our partners, into pharmacies, into community clinics, into our other providers, healthcare providers up and down our state. We would like to continue to move more vaccines out into pharmacies, and we expect that we'll be able to do that. We continue to be focused on fast and fair and making sure that vaccines are available in every community, and that we encourage those that are at a greater risk to get vaccinated, trying to get the message out with all our trusted partners that the vaccines are safe and they're life-saving. So moving on to the next slide, you can see the rate of positive cases is starting to flattening out. That's all good news. And then the next slide, here's our look back, and you can see how the surge that we had here after Thanksgiving and the December holidays, we've peaked out into January now. We're on the downside, and so the number of cases are going down. We're still testing significantly. We're vaccinating at as high a rate as the supply will allow, and so we're providing the protection which will keep people out of the hospital as we continue to run this down. We still need folks to continue to be vigilant and keep your social distance, wear your mask. As I hear from the mayors, I see it myself as I circulate. We're getting very positive. So that's all good news. We did have the big clinic there at Dover Downs this week. Can we see the next slide? We had great partnership from FEMA. Tim here in the yellow, Range Slicker, did an outstanding job bringing in over 250,000 federal employees to move people through. About 15 minutes between the time of check-in they got their vaccine in their arm, another 15 minutes waiting to make sure that they didn't have some sort of allergic reaction, and then they're on their way. So, we've learned a lot from the large clinics that we've had, and we'll be ready as the supply of the vaccine increases in the weeks and months ahead. So let me check out with the slide that shows the delivery of the Johnson & Johnson vaccine to our state, 8,000 doses as I understand it. We have plans for 5,000 in two major clinics that Dr. Rattay is going to talk about, and making available others for our community clinics and to populations across our state. So this is the good news, really positive. We've been saying it for months that help was on the way with a single dose vaccine, and here it is. I'm happy to lead the way, by the way. If anybody's hesitant about this single dose vaccine, I'll jump to the front of the line to set the example that this is a good and effective vaccine. Dr. Rattay.
Thanks so much, Governor. So let me, like always, start with our areas of concern. As the Governor mentioned, we've seen where cases are a little lower, certainly much lower than they were at our peak in December and January, but they are leveling off a little bit. This week, we have actually 12 zip codes that meet the criteria we're using for areas of concern, which is a rate more than 250 per 100,000 people, or percent positive of 15% positivity or higher. So that is an increase. Last week we had 6 zip codes. This week we have 12 zip codes that meet that criteria. Now, a bit of our increase or our uptick this week really is driven by the 340 new cases that we know of at this point that are in the 3 Newark zip codes. We know that many of these cases are tied to the University of Delaware, mostly students, although some staff are also have also tested positive recently. The University of Delaware administration has changed dining hall operations, imposed gathering limits on campus, as the university's daily testing shows a spike, the biggest spike we have seen to date at the University of Delaware for cases. We urge them to continue to be aggressive in their approaches to reduce the spread of infection. We at DPH are working with the university, with the city of Newark, including Newark Police, to dissuade any upcoming parties, especially around St. Patrick's Day. Other areas of concern this week are Houston, Magnolia, Harbison, in Wilmington 19801, Newcastle, Selbyville, Frankfort, Townsend, and Clayton. So we'll keep an eye on all those areas, but our eyes are mostly focused right now on this spike that we're seeing in the Newark University of Delaware area. All right, so let's shift gears a little bit and talk about where we are with our vaccine doses. We have over 220,000 doses have been administered. Now, this count is a little bit behind because the doses administered at the FEMA events this last week, some of them are still being entered into our Delvax vaccine system. So we know that the number is actually several thousand higher, and we will be caught up in a few days. However, as of on the next slide, we'll talk a little bit about the breakdown where we have 142,000 first doses, 77,000 second doses have been administered that are in our registry to date. And again, we know that those numbers are going to be a little bit higher, especially the second doses, which was largely what the FEMA events were focused on. So wait for those numbers to jump up in the next couple of days. On our waiting list, which is Delawareans ages 65 plus interested in vaccination, we have 128 Delaware seniors on that list. At this point, what we can tell when we match our systems is that we have at least 58,000 have received their vaccines so far. So that's about 45% of seniors on our wait list. That is likely a little higher than that. I do want to make mention that when we match our systems together, if the names don't match perfectly, for example, if your name's Joe and you have Joe on one list and Joseph on another, it may not match. So you may still be receiving some emails from us providing updates on vaccination. If you have been vaccinated, go ahead and ignore those updates. But along with our equity efforts, which I'm going to talk about in a minute, we are excited that we are providing 3,500 first dose opportunities for individuals on the curative list by our partner Curative this week in Wilmington, Dover, and Georgetown. So those slots are all full. But those invites came from the waiting list. So little by little, we're going to really focus on tackling the individuals on this waiting list to provide opportunities for vaccination. So let's shift gears a little bit and talk about our equity initiatives. These are our efforts to bring balance to the distribution of vaccine within our state, and they have continued and in fact are increasing and will continue to increase. So far, we have been able to reach over 1,300 individuals through our community health section, through smaller clinics and targeted efforts in harder to serve communities. And on the next slide, I just want to show you just what we're doing this week ourselves and with partners, 10 special outreach efforts that are taking place in a variety of different locations, reaching some of our lower income seniors, including an exciting event that Christiana Care is doing this Friday with the Seeds of Greatness Church to reach 400 or so senior citizens that are members of that church. So we're excited about that. So shifting gears a little bit more, as the governor said, we are extremely excited about a new vaccine in the mix and in our state as of this morning. Our message to the public, our position as an agency, and my recommendation as a doctor is for eligible individuals to get vaccinated with the first vaccine available to you. When you get that first available opportunity, please take advantage of it regardless of the vaccine type. Let's talk a little bit about Johnson & Johnson. This weekend, as the governor mentioned, the federal government granted the emergency use authorization for this Johnson & Johnson Janssen vaccine. It's a single dose vaccine, so it's one and done as far as protection, rather than a patient having to be scheduled for a second dose like with Pfizer and Moderna. Having different types of vaccine available for use, especially ones with different storage and handling requirements and dosing recommendations, offers more options and flexibility for vaccine providers, which is great. All three of these vaccines are really exceeding our expectations as far as effectiveness. All three of these vaccines are 100% effective in preventing hospitalization and death from COVID, which is really just astonishing and a miracle in science. All are similarly effective in preventing severe disease from COVID-19. So again, it's really remarkable that we have all three of them here now. And I will say that the Johnson & Johnson vaccine is 85% effective in US trials at preventing moderate to severe COVID disease, and 72% effective in preventing symptomatic infection. It is different than the way the Pfizer and Moderna vaccines are produced. In this vaccine type, a small piece of the coronavirus genetic material is placed into a weakened version of the common cold virus called an adenovirus. And when it gets injected into the arm, it activates the immune system to create immune protection against these proteins that fight the infection. But very importantly, like the other two vaccines, it cannot cause coronavirus disease in people receiving the vaccine. So you will not get COVID from receiving this or the other two vaccinations. So like the other vaccines, we will not be targeting any particular demographic or population group. We've received 8,000 doses already, but this may be the amount that we get for the month of March. So at this point, it may be weeks until we get any more of the Johnson & Johnson vaccine. But we are going to start with this weekend. We're extremely excited about two events this weekend, one at Seaford High School on Saturday, one on Sunday at the Delaware City DMV, where we're going to be offering a total of 5,000 vaccinations of the Johnson & Johnson. We'll be sending an email and an invitation opportunity to individuals in those areas from the wait list. So for those who are on the wait list, keep an eye on your email and look for these invitations. But as we mentioned, again, as we move forward with the Johnson & Johnson, it's a great vaccine. We're not going to be targeting any specific population. We want to make sure that it's available for the general population, but we're also excited and think it's very important that we make it available in our with our equity efforts as well. Let me shift gears one more time. And I want to talk about improving data collection. As you've heard from The governor and I, in several of our previous press briefings, it's very important to us that we have accurate information in our vaccine database, and especially around race and ethnicity, so that we have an accurate understanding of who's getting vaccinated and who isn't. Now we are up to 88% of our administered doses. We are receiving race and ethnicity data, which is a great improvement. We're really excited. We began our work with the hospitals who were receiving a lot of the vaccine at the beginning, and we've seen just significant improvements with hospital reporting of race and ethnicity. One hospital actually went from 30% up to 85%. Overall average for the hospitals is 94% of hospital vaccination reports are coming with race and ethnicity data. And as we mentioned before, what we were finding was we were seeing some system problems where one IT system wasn't speaking to the other well, and we have largely fixed that with hospitals. Now we're certainly seeing the same issue with pharmacies, and as pharmacies are getting more of the vaccine, including some of the vaccine that went to long-term care residents and staff, we're really focusing hard on improvements for this issue with pharmacies. Really, really important that we get this race and ethnicity data from pharmacies. We are asking pharmacies to work with us to get our systems integrated so we can update our information, and are letting them know that if we don't if they don't get their systems upgraded and get those connections fixed soon, that it could impact their future allocations of doses. So again, this is really, really important to us to get it fixed.
So Dr. Rattay, really great news this week with the arrival of the Johnson & Johnson vaccine. I saw the photograph there, so it's real. It's only 8,000 doses, and to be clear, they've made it clear to us that we won't get any more doses this month. We're going to use 5,000 for these targeted clinics at DMV in Delaware City and in Seaford High School, as you mentioned, with the sign up from the wait list. By the way, the percentage of the tests that we've gotten out, 56, almost 60% of the vaccinations that we've delivered so far have been for 65 and older, which is what the wait list is. And so 5,000 of the 8,000 will go to bring down more of that wait list. And then we'll use the other 3,000 for other ways that we're getting vaccine out in communities across our state. So really good news. That will continue to ramp up in April, and in months after that, we will get more Pfizer and Moderna between now and the end of March. So we were advised of that this morning as well. The federal government, President Biden, by the way, has announced a partnership between Merck and J&J in terms of manufacturing more of the J&J vaccine. And so into April, we'll see more J&J vaccine, and we'll see increases both in Moderna and Pfizer. So the expectation is we'll be able to get more vaccines to our partners, including pharmacies, but we have to have that data glitch fixed with the pharmacies. And so to those of you who are involved in that, thanks for your efforts, and we need to have that done. So if we can't get it fixed, then we're going to have to look to other partners to move those vaccines into people's arms. As I've been saying now for weeks, over the last half a year, that a major focus has to be and has been getting our children back in school for in-person instruction. And Delaware has made real progress in doing that since the pause that we took over the Christmas, New Year's holidays, as we worked with teacher groups across our state. We work with the superintendents. We've got thousands of children, particularly those at the elementary school age that are back in school, and now really making a focus on getting our educators vaccinated, very much helping our efforts to do that. And so Dr. Bunting's here to talk about that and the good work done by it. I need to tip my hat to Dr. Bunting and her team, Christine, and the rest of the gang for really leaning into particularly getting the names registered for the clinic at Dover Downs, kind of a last minute thing, and availability of vaccines that we had there, and we're able to get a couple thousand educators and child care providers vaccinated there at Dover Downs. Dr. Bunting.
Thank you, Governor. And you're exactly right. We call them the DOE clinics, but we've been working diligently for the past 6 or 7 weeks to share with everyone that we've identified, particularly with the risk factor involved. But we have been able to bring in a number of people a week to make sure that they're getting their first shots, and now we're moving into second shots. In fact, when we talk about educators, we're talking about everyone who might be interacting with children in our schools, from the bus drivers to the teachers to the paraprofessionals to the people in the front offices to the nutrition workers, substitute teachers, anyone that might be coming into contact with our children, because we know that there has been concern about who is going to be interacting with your child. And we want people to be very comfortable about coming back to school. So we're really proud to announce that over 1/3 of the educators, 1/3 of the people that are employed by our districts will have received at least their first dose by the end of the week. We're talking about 5,500 people approximately, and we're very pleased at the progress that we're making. We've also been able to spread some of that effort into our child care provider world. And over half of the child care providers will have received at least their first dose by the end of the week as well. So again, 2,200 more people who are interacting with the children in our lives and students of all ages will be protected because of the efforts that we've been going through. We are really proud to announce that we will continue this work until it's finished. But we have, by the end of this week, we're going to have another set of people. We have a clinic at Seaford on Wednesday night. We talked about that one. We have Thursday, Friday, and Saturday for second shots across the state. And usually it's a county situation. So we'll move from county to county to do these. And on the 13th, we have a huge clinic planned for Newcastle County, where we will be able to interact and give shots to another 1,200 educators. So we're quite excited about the effort. We're very appreciative of all the schools that have opened their doors. When we do have a clinic, it's amazing the number of volunteers that come from each of the schools to help us. And they have everything perfectly arranged for the convenience of the people who will be coming to get the vaccine. So a big thank you to the host facilities and all of the staff members who have pitched in to help us. And also, as mentioned, to all of the DOE people. The Department of Education volunteers have been amazing in their faithful service in these clinics. So we give you a round of applause for all those workers, and we turn it back to the governor. Thank you.
Yeah, thank you, Dr. Bunting. It needs to be said again, just a huge thank you to the school nurses who in most of those DOE clinics and pods have been instrumental in running the clinic and making sure it goes smoothly, as well as to our partners with Albertsons Pharmacies, who've provided, in most cases, if not all cases, the vaccinators, those delivering the shots. The clinic that I attended in Red Clay School District at Dickinson High School went very smoothly, and just an incredible effort by everybody involved there. And so that takes us to the end of the presentation. Again, good news with the arrival of the Johnson & Johnson single dose vaccine with incredible efficacy. One dose, it's in terms of the logistics of getting vaccines in people's arm and be able to count each one of those as somebody who's been fully vaccinated can't be overstated. 100% efficacy for preventing hospitalization and death, 85% efficacy for a serious illness, 72%, I think Dr. Rasay mentioned, for modest illness. And so just a real game changer there for all of us, and will enable us to get more vaccines, more people vaccinated, because it's just one dose and you're done in our clinics across our state. So I think we've got media here that's joined us. We would invite any questions that you have.
All right, first we'll go to Nick Ciolino from Delaware Public Media.
Good afternoon, everyone. With the reduction in community spread over the past few weeks, is the state developing a sense of when it might allow visitation at senior centers and other long-term care facilities?
Dr. Rattay?
Yes, so actually, in all 3 counties, the case rates have gone below the threshold value. So visitation is now allowed in all 3 counties for long-term care facilities.
All right, and then with the increased number of teachers being vaccinated, and you mentioned earlier, Governor, 70,000 kids are back in school. What needs to happen to get all kids throughout the state back in classrooms?
Yeah, so I think generally take a stab at that before turning it over to Dr. Bunting. Generally, it's a question of an operational question, right? To enable schools and principals to be able to maintain the conditions within the classrooms, right? So 3 to 6 feet distancing between and among students means fewer students in the classroom. Same thing on buses and transportation. So the social distancing requirements do make it more difficult to have everyone back in school. My understanding is that most districts allow parents to choose whether they want remote instruction or in-person instruction. That enables them, frankly, to accomplish the goals of the hybrid model, meaning a mixed of in-person instruction and remote instruction. The difficulty there is on the teacher herself, who has to teach students in the classroom and maybe remote students at the same time, which I've seen teachers do it. It's very challenging, but I think it's school by school and district by district as to whether they can accomplish appropriate public health guidance and controls with the need for in-person instruction. Dr. Bunting, is there anything there that I missed?
You did an excellent job. There are buses that are bringing in sets of students. Busing has become one of the bigger concerns. We can only put about 23 students on a bus that could hold up to 72 students. So that is a major factor, and parents could bring their kids to school, but the busing limitation of having the 3-foot distance between students is a challenge. The other thing that I would mention is that we are offering the choice to families, and depending on the ages of the children, people are choosing different choices. I was in a school this morning where it was explained that although they have extra space at this point, it was obviously a high school, that they are polling their students and inviting them back in, but many of the students or their parents are choosing not to have the students come for in-person instruction, that they are doing in many cases well with the remote learning, and they choose to stay in that part of the format, the hybrid format. So it does reflect also parent choice.
All right, next we'll go to Amy Cherry at WDEL.
Hi, everyone. You touched on this a little bit, but I wanted to try to dive a little bit deeper into it, and it's kind of a 2-part thing. I'm wondering if you're at all concerned about public perception that the J&J vaccine may be inferior and that maybe less people will be willing to seek it out. And then secondly, are you concerned that given that public perception, that usage of the vaccine in underserved communities could raise concerns about equity?
Yeah, I would just say that the data kind of speaks for itself, 100% efficacy for hospitalization and deaths, the number one thing that we think about. It's been tested, obviously, I'll defer to Dr. Rattay with respect to the science of it. It's been tested in different circumstances than the Pfizer and the Moderna some greater efficacy, I understand, with the so-called variants, which is something that we're fearful of coming down the pike. Basically, we want to treat it in a similar fashion. There is great benefit, frankly, to being able to do it with a single dose and to get those results. And again, going back to our objectives of fast and fair, it certainly is and accomplishes fast a lot better than the 2-dose, and fair, I think, is kind of in the eyes of the beholder. We look at it in terms of demographics, and that everybody ought to have the same access to all these life-saving vaccines and make those decisions. I think one of our challenges is we still have hesitancy over a vaccine period. We saw the poll that came out from the different school districts that showed a high of one school district, 85% of their teachers and staff wanted to get the vaccine, to the other extreme, only 50% wanted to get the vaccine. That's a big gap in between. And so we need to make sure we're getting good information to those folks who are hesitant, whether it's a single dose or 2 doses. Dr. Rattay?
Yeah, I mean, I don't have a lot to add. I mean, we don't see it as an inferior vaccine based on the science. We see it as an incredible and exciting new tool in the toolbox to add more vaccine into the pool, and also to make it easier for those who want 1 dose as opposed to 2. That being said, we want to make sure that the public is aware and able to compare and learn about the different vaccines. We have placed on our website a chart that compares the 3 different vaccines. And we also think it's important that for vaccination events and activities that we're transparent about what vaccine is available. I mean, some people aren't going to want 2-dose vaccines now that they know that 1-dose vaccine is available. So, we want to make that information available to the public for sure. I mean, we will certainly be closely watching public behavior and perception as we go forward, but we don't personally see it as an inferior vaccine.
And to that last point, and to your overall point, Amy, it is just the idea how it's going to be received by the public is something that we'll be looking at because we don't want to have any misperceptions, just like the misperception or the hesitancy around getting the vaccine in the first place.
Thank you.
Next, we have Sean Green from WDEL.
Secretary Bunting, Brandywine Superintendent Lincoln Holler said during last week's school board meeting he expects it to take 18 to 24 months to get back to normal due to learning loss from remote and hybrid learning. Another district is reporting a doubling of D and F grades in English and language arts. How is the state planning to help struggling students get back on track as hybrid has seemingly no timetable for ending?
That's a good question, and that's going to depend much on the actual districts themselves. We have been receiving some amazing amounts of money from the federal government. Most of that money, all except 10%, immediately goes out to districts, and a focus of those funds happens to be the recovery, as it's called. We prefer to say accelerated learning plans. We at the department are investigating several of the purchases or the investments that would affect or be available to all the students throughout the state. And districts can choose to be a part of that, or they might choose to invest funds in something that is particularly effective in their minds for their particular student body. They also, at the district level, will be designing whether it's after school programs, Saturday programs, further training for their teachers. They hopefully will have data that will show exactly where their students are and then be able to address the individual needs of that student. As far as the failure rates and so forth, that is an issue that several of the schools that I've talked to, and as I said, I'm in and out of schools all the time, they're looking at it at a district level to see if there's some kind of extra opportunity that can be given to students during this current school year to avoid their actually failing the course for the year. But they have a lot of money at this point to invest in extra supports. And as I mentioned earlier, the money that's coming from the federal government in the stimulus packages has a major focus on this recovery or getting kids back on the level that they might have been if we had been in school in a regular situation. We do need to have data to show us what that difference might be for the students. And as I said, individually, it's going to differ. So we need the data upon which to make our plans. And we're working with districts to think about how they're going to get that data. So we're on top of the situation as far as knowing it's something that needs to be addressed. And we're taking steps to work with the districts to make sure that they're moving in that direction for the sake of our students.
If I may, as governor, this is one of my biggest concerns in terms of the effect of COVID-19 on our state, is the effect that it's had on our students, whatever grade they're in. If they're in pre-K to third grade learning to read, where are they along that trajectory? Where are our high school students? We need data to be able to assess that, and there's a discussion going on about what's the best way to do that. There is, as Dr. Bunting said, considerable federal resources to address this issue. We need to be looking at what are we going to do with our students during this coming summer, because it's an opportunity to help students get to where they need to be and to catch up. And so our team, Dr. Bunting and her team, are engaging, and will continue to engage with the districts on first determining how to do that assessment, and then figuring out how to best intervene to help each of those students get where they need to be. This is a big concern, right up there with making sure that our small businesses survive and are successful as we come out the other end.
All right, next we'll go to Brandon Holbeck with the News Journal.
Good afternoon. I'm curious how the sign-up process with the Johnson & Johnson vaccine now will work. Like if I'm offered the vaccine, let's say for one of those events this weekend, but in my head, I think I'd rather have the Pfizer or Moderna vaccine, or vice versa. I'm offered a Pfizer or Moderna event, and I would prefer the Johnson & Johnson vaccine. What should I do with that invitation? Will I be put to the bottom of the state waiting list? Will I be offered the next opportunity? Like how would that work? If I've looked through the options and I've kind of weighed one over the other for whatever various reason.
Yeah. Hi, Brandon. So, as we have said, we recommend that people take the first vaccine that is available to them, regardless of type. But that being said, we've had plenty of people in the past who've received invitations, and maybe the location, the time, the date wasn't good for them. And there's no penalty for not accepting an invitation. We continue to match, as I mentioned before, those on the list who've been vaccinated versus those who haven't. And so we're going to continue to offer invitations to those who've not been vaccinated. So if you don't take advantage of the invitation, or you're not able to get signed up, then you'll stay on the wait list, and you'll get another opportunity for vaccination in the future.
The basic message is take a vaccine when it's available, because they're all efficacious. They're different. Obviously, one's a single dose now, and the other are 2 doses, but just look at the data.
And my second question, is there a threshold or an estimate of how deep into the waiting list the state would want to get before kind of shifting priority to other groups like the essential workers that are in 1B or even the next phase of the vaccine plan?
Yeah, I'll let Dr. Rattay take a shot at this too, but this is just to say that this is a question I get all the time. When am I up next? When's my group of essential employees going to be next? Been pretty systematic, moving through the priorities established by the federal ethics panel, the state panel, thinking about equity, thinking about other considerations that go to the issue of fast, and fair. And we'll continue to do that as we think about the next set of essential workers, which is next. The question I get most is, what about me? I'm in 1C, kind of the general population. We'd like to get there as soon as we possibly can. And one of the questions is, when do you figure that as many people who want a vaccine have gotten it, right? I mean, because we know that there's hesitancy out there. We could wait forever, say, for 1A folks to step up and get a vaccine, and we know that they all did not do that. So we moved over to 1B, 65 and older, and then into the essential worker categories. And so it'll be something we'll continue to look at with that focus on, the approach that we've taken in terms of priority populations. Dr. Rattay.
Yeah, I don't really have a lot to add other than, it really is based on the ACIP and our ethics committee recommendations, and the data, very much show us that those who are 65 and up are at the greatest risk of death and hospitalization. Even those younger with chronic conditions have a lower risk. So age is really so incredibly important as a risk factor. And we want to make sure that our seniors, specifically our seniors who want to get vaccinated, have an opportunity to get vaccinated. We are, as you've heard from Secretary Bunting, we're excited that we're starting to really work through the 1B workforce, and we're going to continue to work through the vulnerable members of that 1B workforce to make sure there's an opportunity for them to get vaccinated. But we're really, really looking hard right now at the numbers so that we can get more specificity around now that our dose allocations seems to be more predictable in the last few weeks. We're trying to really crunch the numbers and get more specificity around when we can move into 1C comfortably.
And to that point, if I may, it becomes a math problem once you make certain assumptions about hesitancy, what the total population is of essential workers. And we have that demographic information that we get from the University of Delaware. And I think with these numbers you see on the screen, or you should see, I think, on the screen, we're not quite 50% through in first doses. I'm looking for Dr. Rattay's nod. But essentially, we can get to a kind of a formula about when you would think about moving to the next group. And if you think about what we've said before about hesitancy, just looking at the school personnel continuum from 50% to 85%, and a distribution in between, you're not going to have 100% who want to get vaccinated. So at some point, you've got to thinking about opening up the next group. And at the end of the day, Brandon, it's really a question of supply. And as I listened this morning and heard what I heard from the White House task force and Jeff Zients, we're going to get 8,000. We get 8,000 J&J now, nothing for the rest of March. Moderna and Pfizer are going to continue to increase in smaller amounts for the next of March and then into April. And then things will start to pick up after that. So you can start to think about, and by the way, you can see on the screen, we've got a lot of second doses that have to be done for the Moderna and Pfizer when you've got only 77,000 that have been done. And that's why the J&J vaccine is such a game changer, because every dose is somebody who's fully vaccinated.
All right, next we'll go to Tim Mastro from Delaware State News.
Hi, everyone. Just following up a little bit on the FEMA event. Did it meet your expectations in terms of what you thought it would be? Maybe the week before, did you do as many doses as you were hoping? And were there any doses left over? If so, what happens to those doses?
Yeah, so just at a very high level, it was fantastic. I mean, there's no other way of putting it. It was a tremendous opportunity with all staff provided by FEMA, with volunteer federal workers from across the country, over almost 250. They ran all the clinics. It was as smooth as ice, as smooth as could be in terms of the way it was set up. Thanks to Dover Downs and the raceway there for allowing us to use huge property so you can space the cars out. No traffic problems leading in. We scheduled we were able to take a lot of people and get them their second doses, which was a big concern. You know, if you have a big vaccination clinic for first doses with the 2-dose vaccines, you got to come back 21 and 28 days later and do it again. And that was a challenge and enabled us to do that. It frankly, you know, from a psychological point of view, gave those who made it had a little bit of a negative experience in their first dose a very positive experience in the second dose. So that really helps. And if you want to see people that are happy and relieved, you know, go to a vaccination site in our state, and that's what I saw there. It enabled us. If there was a disappointment, we didn't get all the folks that got their first doses. The good part about that is it enabled us to vaccinate over 2,000 educators and childcare workers. The childcare workers have been on the front line and haven't closed since day one. And they were over the moon happy about it. Taking away that anxiety from them and from our teachers has huge benefits beyond just the health benefits. So really tremendous event from so many perspectives. Dr. Rattay?
Yeah, I mean, I would say I think it exceeded our expectations as a site. It's a really great site to do this kind of work. You know, medium or really large events. I mean, it's really a great site. And you know, I talked to a lot of people while I was there. People don't seem to mind driving to Dover. In fact, a number of teachers I spoke with were, you know, just so happy to get it. And I think most people didn't feel that getting to Dover was a problem because it was such a smooth event. You asked Tim about were there any extra doses. So I think an interesting observation for us is, although we, with the exception of the Friday afternoon, filled all the spots, all the vaccine spots that were available, we had a lot of no-shows. We had a lot of people who did not show up. What that means to us is they got their second dose somewhere else and just were unable to pull themselves off the list. So, you know, you could look at that two ways. One is, of course, we want to use, you know, every opportunity to get vaccine into people, but clearly that second dose demand has clearly subsided. People met their second dose needs last week, either through our FEMA pod or other places in the community like pharmacies and hospitals. So I think that was a positive. And the vaccines that we did not end up using for the event, you know, went back to the warehouse. You know, Dr. Hong has a plan for every one of these, but they're going back out now for use with our community partners or through, you know, other work that we're doing.
Right. So the last 2 weeks, the focus has been on those second doses. Just wondering, kind of what's next, and do you anticipate that being kind of almost a schedule where you'll have a focus on first doses, and then a month later, you're going to really have to be trying to get the second doses out there until probably we have enough doses of the Johnson & Johnson one, right?
Yeah, you really have figured it out, and that is once you have, and this is the challenge of having big events for your first doses, is you've got to replicate it, you know, down the road. Now, we used the Dover Downs to fulfill that obligation that we had established a month ago. It'd be better if we could smooth it all out, right, and have regular distribution through our pharmacies and community partners that then can build in a replication 21 days and 28 days later. When you have a one-dose vaccine, it's one and done. That's beautiful. When you talk about being able to do large clinics with a one and done vaccine, it just makes it so much easier. But you're right. I mean, if you have a regular flow, and just think about the math, your number of allocation of doses from the federal government has to increase at a rate to keep you up with the people who are qualifying now for their second dose after getting their first dose, if you're going to move the needle. And so having both and having the increase in supply occurring for your first doses, yeah, that's going to help. But having that one and done dose really is the game changer. So we'll have to see how the math works out. We're trying to build, and you heard me say earlier, to the extent that we can build on our pharmacy network, and do it in a way that's demographically equitable. That's kind of the best scenario, because then you can build in those second dose scheduling a lot easier. I think if you think about the J&J, if we ever get big supply, that really is an opportunity to do a big clinic, because it's one and done. You don't have to worry about coming back 21 days or 28 days later. But you really put your finger on to the challenge that we and other states have had to deal with without having our allocation, our supply increase at a rate necessary. We were doing really great, and we were encouraged by the federal government to do great, and all the people that we work for. Well, once you do that, with your first doses, you got to replicate it, and you have to have the supply to replicate it. So that then prevents you from using your supply for your second doses. So that's the balance we're seeking to strike.
All right, Governor, this is the last question. It's pre-submitted from Susan Canfora at Coastal Point. She asks, what's the best central website for Delaware residents to get all necessary information about making appointments, be vaccinated, and where to go to get vaccinations?
Well, I'll defer to Dr. Rattay, but I use de.gov/coronavirus. Go from there to the My Healthy Community, check out the data first. And then at the top of the page, there's a vaccine tracker that gives you all the vaccine information. I think you can get directly to the vaccine tracker if you go de.gov/vaccine tracker. Is that right?
COVID vaccine is a good one to go to. So de.gov/COVID vaccine has a lot of good information about the vaccine itself. And then there's also another site, specifically de.gov/get my vaccine, that, to answer the specific question, is really provides a lot of detail about where to get your vaccine.
And we've encouraged folks to, check with your local pharmacy, check with your primary care provider, get on the wait list if you're 65 and older. It'd be great if we were all integrated and you just apply at one place and it went to all the different partners. Unfortunately, it doesn't work that way, but we're doing better. We're getting more people vaccinated with the first vaccine. We just did close to 10 to 15,000 second dose vaccines. We've got 5,500 educators with a priority towards those are a little bit older, those with pre-existing health conditions, those that are working with special population children which require more hands-on contact. We're pushing our equity, fast and fair objectives. That's the thing that frankly I spend the most time concerned about, thinking about ways, talking to people that help us, legislators, local elected officials, faith leaders, community leaders, to try to figure out how to encourage people to get signed up. Really, that's the hardest thing with respect to the equitable distribution of the vaccine, is getting people to sign up on our wait list for those 65 and older, sign up at your local pharmacy, sign up for a community vaccination site coming to a community center or a worship center near you. And for those of us who want to volunteer and help, that's the most important thing that you can do, is help us get people signed up, and we have a lot of folks that are doing that. I want to thank everybody for joining us again today. We are making real progress. I have a feeling that we're turning the corner. We're getting healthier. Our data is headed in the right direction. We've hit a little bit of a speed bump with the cases among university students at the University of Delaware. It's just going to be a speed bump. We've got the J&J single dose vaccine coming here, 8,000 doses, and then more at the beginning of April, increasing number of the 2-dose Moderna and Pfizer vaccines, equal efficacy really for all three. So when you have an opportunity, take an opportunity to get those and make sure you avail yourself of that. We're focusing on making sure our small businesses remain viable and stay in business, and always looking at the restrictions that we have in place. At the same time, encouraging people to wear masks and keep socially distanced so we don't lose the progress that we've been making. There's the advice that we give everybody: wear a mask, keep your social distance, wash your hands, get tested. We're testing at rates that far exceed what I thought we would be able to do. And so we're working through this. We're getting better, getting healthier, and sooner we're going to be at a much better place. Thanks for joining us today, and we look forward to seeing you next time.